So with it being Neurodiversity Week, something we both feel really passionate about, I wonder if it'd be helpful for us to start by thinking about what is neurodiversity? How do we understand that?
Well, this is actually pretty new language, right? When we think about neurodiversity, we're thinking about all the different ways that people kind of experience and interact with the world around them. And there's so much that kind of is encompassed by that umbrella, right? But yeah, there's this real move away over the years from thinking about deficits and disorders, and instead thinking about differences and how we can better meet the needs of people who might have these differences. Right?
Yeah.
And it's a big part of what we do.
Absolutely, absolutely. And I think probably one of the big things that we think about when we think about neurodiversity is the autism spectrum.
Absolutely.
And I think one of our roles, you know, is holding diagnostic framework in mind, but also thinking about how that presents in very different ways, sometimes outside of the kind of clear diagnostic criteria.
Right, because I think a lot of people, when they think of autism, they think of social communication and interaction differences in that kind of reciprocal back and forth, differences in what kind of things draw our interest and what kind of behaviors we might see for a child or young person. And that's that kind of quite traditional diagnostic way that we might think about autism, but it is so much more than that. And we have these conversations day to day about children and young people who maybe present in different ways.
Yeah. And I think something that we often see clinically is that, you know, in that kind of 2 to 5 year age range, we sometimes see the more kind of classic signs of autism. We see our young people with speech delays. We see our young people that maybe have some differences in the way that they're interacting and relating to their peers, and some overall delay in their communication. And in some ways, when we see those young people, it can seem a little bit more structured in kind of understanding the presentation. I think something clinically that we see is when we see our young people who are that little bit older, who have navigated the social world through their 5, 6, 7s, up to maybe sometimes teens.
Right.
And they present in the clinic with presentations from emotional dysregulation, sometimes some social withdrawal, some differences in the way in which that they're presenting and interacting. And I think one of our roles, isn't it, is sometimes thinking about, you know, addressing the presentation that we see, but also holding in mind if there are any underlying neurodevelopmental differences that could actually explain some of these presentations.
And I think that's where it can sometimes be a kind of more complex journeys for children and young people and their families. So in that kind of first example where people maybe have heard about some flags for autism, they come with that kind of idea in their mind. There is an obvious kind of pathway where we can kind of explore those things a little bit more, but these kind of more subtle or kind of atypical presentations, I'm thinking about children presenting with school refusal, with lots of anxiety, maybe presenting as being very low in their mood a lot of their time. And actually, it's when we explore and kind of dig a bit deeper that we think there are some underlying differences here that can help us to understand those things that we're seeing, right? And importantly, informs what kind of support we might offer.
Absolutely. And I think, so when we see those young people and we kind of see some emotional dysregulation, we see some differences between clinical settings. And one of the things that we might do is we might collect evidence from school, from families, from the young person that leads us to think, okay, maybe there might be an underlying neurodevelopmental presentation which might lead to an assessment and possibly a diagnosis.
Right.
And I suppose a helpful thing to think about is when we work with these young people, you know, what is it that we offer? What is helpful?
Yeah.
What are your thoughts?
Well, working as part of a multidisciplinary team gives us this advantage of being able to think really holistically about what a child or young person needs, because no two children or young people, that's by definition, when we're talking about neurodiversity, right? Everybody's going to have a different profile of strengths and kind of differences and support needs. So we might go down the road of thinking about input from ourselves, so psychology, particularly as it relates to social emotional support needs, but often our speech and language colleagues, our occupational therapy colleagues play a really big role in supporting young people to kind of, not just in terms of sort of picking up skills, but also thinking with adults and caregivers about the environments that these young people are in and how the environment could be adapted to suit their needs better. Right?
So the big thing, I suppose, is what I'm hearing you saying, and what we know clinically is that, you know, our role is working with the young person, you know, and again, depending on the young person's abilities and areas of strength, but also challenge, we might think about some social emotional skills support.
For sure.
And that might be delivered on an individual level or also a group. So we know that social skills groups can be fantastic, bringing other young people together with similar strengths, but also challenges. And that's a great forum for practicing some of this work.
Right, and normalizing their experiences, right? A lot of these young people will have a lot of insight into feeling different from their neurotypical peers, and it can be really powerful for them to come into a room with other young people who have also felt like they've been different in some way. And we can talk about it to them, but when they talk to each other about it, it's so powerful, right?
Absolutely.
Yeah.
And I think a big part of what we also do is whilst we're working with the young people and their neurodiversity, and we highlight their strengths, but also where there's sometimes some challenge, part of our role is also thinking about any comorbid presentations.
For sure.
And thinking about those comorbid feelings of anxiety, possible low mood, which are often mediated in the context of their neurodiversity.
Absolutely.
So we might deliver some cognitive behavioural therapy, which is evidence-based intervention for anxiety and low mood. And again, thinking about that neurodiversity, the importance of being able to modify those interventions per the young person.
Right.
And thinking about how cognitive and flexibility, and sometimes those challenges that young people face in being able to put themselves in other people's shoes, being able to challenge and understand some of their thoughts, understand their emotions. So actually that's the core basis of the work we need to do before we then link into that more formal kind of behavioural intervention.
Right. And often we see young people with a preference for kind of more visual thinking and reasoning and learning. So adapting our evidence-based therapies, whether it's for anxiety or mood, is absolutely what we know is best practice when it comes to socio-emotional skills. And a lot of what we're doing is adapting therapies to suit the needs of our neurodiverse children and young people, right?
And you also touched on a really good point there, and thinking about, when we're thinking about neurodiversity, and we're thinking about autism, we think about those social communication skills, but actually a huge part of what we need to hold in mind is some young people's learning profile.
Absolutely.
And actually how that neurodiversity can show itself in different kind of cognitive strengths and needs. And actually a role for that being shared with educational providers, so they're also aware of the different learning needs of the young person, where their strengths are maybe verbal skills versus maybe some difficulties with their processing skills.
For sure.
Because all of this understanding is going to help the young person, holistically across the board.
And I think a lot of people would think about learning differences in a classic sense of kind of young people with, say, lower than average cognitive functioning or difficulty accessing a mainstream curriculum. But equally, we see lots of young people who are neurodiverse in the sense that they have incredible skills and strengths within their cognitive profiles. And I think sometimes they can be missed, their needs can be missed in terms of maybe challenging and making sure we're providing an enriching learning environment for them equally, right? So meeting young children and young people where they're at in terms of their learning, both formal learning opportunities at school, but also what we're doing with them across settings.
Absolutely. So I think, what we do is we meet the young person and we think about their needs kind of on an individual level. We think about their needs within the system, so thinking about educational provision and support. And we also meet the young person's needs through the family context.
Absolutely.
So a lot of the work we might do is supporting parents, be it and understanding their young person's presentation, specifically with our more younger population, that kind of 2 to 5, that have those language delays, have those differences in their communication and play skills. We can offer some paediatric autism communication therapy, which is really an excellent evidence-based intervention for looking at the relationship between the young person and the parent, and how young people with autism and neurodevelopmental differences have differences in the way that they interact. And actually, if we can support the parents in being different and challenging some of their differences with their young person, but actually then that plays out.
100%. And I think we often have parents coming in saying, I'd love to be equipped with the skills to bring out the best in my child or young person, right? And PACT is something I know you're very passionate about, and something we really believe in, involving parents and carers and teachers in being equipped with the skills and the confidence to, meet that child or young person where they're at and help them, on that journey that they're on. So we definitely think about working with a child and young person, but we're working with the entire system and thinking about what needs to change to kind of, make sure that we get the best out of them and support them along their way.
So it's a real team approach.
For sure.
For working with our young people.
For sure. So Mary, we've spoken about lots of things today. What for you would be some take-home messages that you'd want people to take from our chat?
Okay, I think the main thing would be that, neurodiversity is complex. And I think, whilst we know that we have diagnostic criteria, and that's exceptionally important and clinically needed, I think it's holding in mind the need to sometimes go beyond that. And to acknowledge that, young people present in different ways, and their behaviours may present in the context of neurodiversity, and actually it's holding that in mind as part of our formulation, part of our thinking, trying to help understand the young person's differences.
So that's key to our role, right? When families arrive, you know, part of what we're doing is holding in mind all these different possibilities, including the fact that neurodevelopmental differences might help us better understand whether it's social or behavioral or emotional issues that have brought people in to see us. And I'd really want to kind of encourage people, if they have a concern, to come in and sort of have that opportunity to think through those things with a multidisciplinary team that is good at kind of assessing and supporting families who might have a young person who has neurodiversity in place, right? And I guess intervention or kind of support is the other key thing we were talking about.
Yeah, and I think it's, you know, it's really important that, you know, if we have young people with neurodiversity, there's a whole raft of interventions and supports out there. You know, we've got education, we've got psychoeducation, we've got intervention for social skills, we've got individual support for any comorbid mental health problems. There's lots of evidence-based interventions that, you know, that we deliver at a kind of high level that we know can be really helpful for these young people.
Yeah, especially when it's based on a very good assessment and an individualized, person-centered kind of plan that keeps the whole young person in mind, and not just areas of difference, but also their interests and strengths, and the strengths that their system, their family and their school already have in place.
Absolutely.